My name is retired Staff Sergeant Jesse Valdez. Joined the military when I was 18, did my 20 years in two stints, did 8 years the first time, and then I went back and re-enlisted in 2006, was stationed at Camp Taji, Iraq from 2006 to 2007. I came home for a few months. I went right back in 07, 08. This is when a lot more things happened as far as my well-being. We were in a military escort, gun trucks. So if I wasn't driving, I was a truck commander. If I was in the truck commander, taking care of everybody in the truck, I was in the gun turret. In the gun trucks, we had to wear several layers of protection, which included the vest and, of course, headgear. That is where a lot of my problems started. When I was in the back of the truck, I would be strapped in, 5-point harness, and again with my gear on and the helmet, and we hit a blast hole, and I actually flew up, hit the top of the truck. Luckily, I had my helmet on, but that's when I could feel something actually happened. I believe a lot of I sustained most of the damage. Most of the pain started the second I hit. Not wanting to complain, I just didn't say anything like a lot of people did. I didn't want to get sent home. As time has gone on, the same area where I felt the initial pain, it's like happening all over again. My neck, right above where it hurts today, right above where the neck and the shoulders meet, down to my lower back. I've been dealing with this pain since about 2007, 2008, and to this day, I still feel it. Well, initially when we got back, trying to get worked in with the VA, didn't work out so well. I wasn't happy with the results I was getting. They were talking surgeries, and it just wasn't what I wanted to do. Become a patient of Dr. Landrum's. He did the initial MRI. It turned out that I had degenerative disc disease in my neck and in my lower back. I'm not here to make it worse. We're hoping that this will help you. It will help take care of the problem without surgery. That was my whole intent. That was my goal. My hopes were to eventually get off the medication that Dr. Landrum knew from the onset that I didn't want to be at. But because of how I was going, the progression, and it was just the pain was getting more and more and more, it was a relief. Once I got on the medication, it was a relief. But now, because my desire is to get off of the medication and be free, not having to worry about taking any more pills, the laser, I knew it worked. I would be lucky to get 4 hours sleep consistently. The 2 days after the initial treatment, I was sleeping very well. The numbness in my arms, the coldness was gone. It was like night and day. I was like a new person. Along with not just the sleeping, but my mental status was, I hadn't felt that good in I don't know how long, how many years because of the pain. Like I said, I was well rested. I was able to do more. I was able to enjoy more activities than I had prior to the treatments. I was able to, because I enjoy cooking, I was cooking more, spending time with my wife, going out and doing more activities, even though it was just yard work. It was mind-blowing, for lack of a better word, how effective the procedure was. My hope is to get back and do more treatments with the laser because I know it's work. I know wholeheartedly that it does work. For those that would be able to do this, I strongly suggest that you give it a try.